Correct. Can you hear me, guys?
Can we treat scleroderma, lupus?
IgG4 related disease.
How HSCT works for ILS or doesn't work?
Can I take Neurontin 300 mg?
Till now, I didn't take any medication. What do you think? It's better now to do it, or it's not get any benefits?
But symptoms like fatigue and depression, these are very common. Would the transplantation help with symptoms like this?
In some days I feel better, in some days I feel bad.
And now I'm considering to come to your place, even though my doctors are against this. So I don't know what to do.
Ben size gelmek istiyorum ama uygun aday mıyım onu öğrenmek istiyorum. Bunu İngilizceye çevir.
Is it do people lose a lot of weight from the treatment?
What's the level of lymphocytes should be on discharge?
So nice to meet you, doctor. I hope you're well also.
Hello.
Hello.
Hello. How are you? Nice to hear you.
I'm good. How are you, doctor?
I'm okay. Nice to hear you. Okay, so I'm ready to answer your questions.
Okay. My name is Ala. I'm Raunak brother.
Okay, nice to meet you.
Nice to meet you. We have a lot of questions, but I'm gonna ask you just 3 questions specifically about Raunak case. So is that all right?
What do you mean about Ramnak case?
Specifically, yeah. When she gonna be discharged on Monday, if she faced when she gonna come back to home, if there is any fever or maybe any infection, so what is the steps that we have to do?
Okay. So we give complete report before discharge, and of course we had discussion with Ramnak, and she had instructions. If patient has fever and if patient has infection, especially in very disabled situation when immune system weaker than normally, this is around first 1 to 3 months, I recommend to go to doctor to be checked by doctor. This is lab results, maybe cultural screening, urine test, blood test, and of course our team and me personally are in contact. But of course, distantly we can't check patient. It's impossible. Patient who is far from our hospital having fever or infection should be checked by a local doctor, like family doctor, internist, any doctor. So. And of course, we are ready to be in contact with these doctors. And the patient should give our report we give in English to this doctor for complete understanding situation. And of course, in case of confirmed infection, patient can use antibiotics, antiviruses, antifungals medication, depending on clinical situation.
Exactly. The second question, please. I'm asking about the immunization. As it is now known her blood not contain any antibody against the normal schedule of the vaccination. She lost all the antibody. Is that right or not?
No, it's not right. Patient has previous antibodies because during high-dose chemotherapy, we remove autoaggressive T and B cells, but not antibodies previously produced by vaccines in past. So previous vaccine memory is still here in the body after transplantation. But we don't recommend to repeat vaccination because routine vaccination can increase risk of relapse. It's additional irritation of new immune system. Sometimes multiple sclerosis starts after vaccination. For example, for cancer patient, we recommend vaccination after transplantation, but not for autoimmune disease like MS. So vaccine memory is still here in her body. So we don't recommend unnecessary routine vaccination, only in some important clinical situation we discuss personally. And that's all, I think. She has her previous vaccine memory.
Okay, last question, please.
Yes, I'm ready.
Yeah. As you know, the problem with the autoimmune disease and another disease like AIDS, we have the memory cell. So until now, the studies and the research failed to find vaccination or to kill the cells that contain the memory cell that have the antibody memory about the AIDS. Also, in any infection or any autoimmune disease, the memory cell is the problem. So, in your protocol, did you targeted the memory cell or what exactly?
Yes, lymphoablative program reduce amount of T and B cells, including T and B memory cells. So, but of course, on genetic level, patient has information or is responsible for autoimmune diseases like MS. We can't edit genes, so it's impossible. So we rebuild immune system, removing autoaggressive T and B cells and decreasing amount of memory cells. Of course, all we have cancer cells, autoimmune cells, normally in our body in healthy situation, but amount of these cells is quite low, and these cells are under control of special T cells. The name of these cells, T regulatory cells, and these cells regulate amount of normal and bad immune cells in our body. So after transplantation, we rebuild immune system to previous normal level. And it's proved that after transplantation, amount of T regulatory cells is much higher than before transplantation. Of course, risk to have relapse is high to compare with general population, but it's considered that patient is MS-free because previous studies which were provided 15, 20, 25 years ago, animal models, research trials confirm that patient after transplantation has normal immune system which is tolerate to patients to myelin. So it was proved by research in animal models.
Yeah, because in one of the HCT groups, one of the patient, maybe he is patient or not, he said that maybe after 10 years, the disease gonna come back.
It's not true. It's possible, but not true. Sorry for interrupting. We have many examples. Take a case of Anastasia who had transplantation more than 10 years ago. And now we are collecting data about long-term follow-up results. We have patients who had transplantation in 15, 17, and almost 20 years ago. We started our activity in 2005 in Moscow. And these patients are very good. Mainly they are doing well. It's not true that 100% MS will come back in 10 years. Risk is still here with possible 10, 15, 20% of risk during long-term follow-up. This is statistic we published. We discuss this statistic, and of course we can't guarantee 100% of results of success. It's impossible, but success rate is much higher if we compare transplantation with traditional treatment. So using all modern medication, it's impossible to stop MS for many years. All this medication only delay progressions. So this is the name of this treatment, disease-modified treatment. Only transplantation can stop it. And of course, not in 100% of cases. And the more difficult situation, more progressive disease, high disability level, unfortunately, longer disease, unfortunately, risk to have further deterioration is higher if we do it in early stage. This is why we postulate to do transplantation as soon as possible. Firstly, to prevent severe disability, and secondly, to reach high success rate. But it's not correct to tell that after 10 years, all patients with MS will have relapse.
Okay, thank you very much, doctor.
You are welcome. You are welcome. Also, you can find our result in our articles. Also, we are going to publish our long-term follow-up results later. So these data are opened.
Okay, thank you very much.
You are welcome. Thank you for your questions.
Hello, doctor, and
Anastasia.
everyone. Yeah, you
Nice
missed
to
me a
see
little
you.
bit. Hello, everyone. Hello, dear friends, ladies and gentlemen. Welcome to our webinar. I'm glad to see everyone here who enjoying us. So, my friends, doctor, another question for you. Unfortunately, another patient can't join us by online and want to ask how HSCT works for ILS, or if it doesn't work, please explain a little bit the difference.
Okay. I'm very sorry that some of our friends can't join our webinar. Okay, what about ALS? Amyotrophic lateral sclerosis. This is not a very bad condition. So this condition with unknown origin or unknown mechanisms, and it isn't proved that ALS is autoimmune disease. ALS is based on quick death of special motor neurons, special cells in spine, which provide main functioning of the body, like movement, breathing, everything. So the reason of quick death of these cells isn't known. Nobody knows what is the reason and what is the mechanism of this disease. So all immunosuppressive drugs, including transplantation, are not effective here. We had a very small pilot study almost 20 years ago. We included some Russian patients with ALS, and we tried, it was 6 patients. And we tried to give chemotherapy. We combined this chemotherapy, high-dose chemotherapy, with intrathecal injections of hematopoietic stem cells. We did lumbar puncture, and we sent stem cells directly to spine, thinking that on the one hand, we decrease regulate immune system. On the other hand, we will try to help these dying nerve cells. But unfortunately, effect was almost zero. So, and all recent studies haven't found any very effective drugs for this condition. So this is why we don't treat ALS, including transplantation. So I think, unfortunately, we can't help here.
Thank you, doctor, for so detailed reply. It's very important to know. So, and we have our friend, Dr. Milan. He will come to our treatment in Moscow in January and have some questions for you, doctor.
Okay, so I'm happy to meet Dr. Milan. Hello, doctor. So your colleagues, nice to meet you. Maybe you can ask questions which you were going to ask me on Tuesday.
Yes.
If you have additional questions on Tuesday, I am happy to discuss.
Well, if we will meet on Tuesday, then I can leave my questions for Tuesday. But just a thought: have you had patients with those without MRI activity, so the so-called PERMA patients? I have failed ocrelizumab, and honestly, we don't know. They don't know what to do with me now, what to give me, because I've progressed. EDSS has gotten worse by 3 points in 1 year, and I don't have any MRI activity. My labs are fine. I'm otherwise healthy, but I have trouble walking, serious trouble. And now I'm considering to come to your place, even though my doctors are against this. So I don't know what to do. So have you had such patients, and what's your experience?
Firstly, thank you very much for this important topic, because we have had lots of questions about this situation, and I will try to explain, because it's useful for many patients all around the world. So this situation is quite typical for primary and less for secondary progressive multiple sclerosis, when patient has clinical progression and stable MRI. Some these patients has a great effect of corticosteroids. Sometimes they have relapses. Without new and active lesions, they have clinical relapses. They receive a high dose of methylprednisolone or steroids, and they have dramatic improvement. It's well known that high dose steroids decrease inflammation. And they are very helpful in acute attack, in inflammation, in acute inflammation, in neuroinflammation. So on the one hand, we see quick progression, which confirms inflammation. On the other hand, we can't see this inflammation on MRI. And the reason is that in this situation, in 10, 15, 20% of progressive variants of MS, MRI is limited to detect inflammation. Inflammation is different. If we do another research, a strong MRI 11 Tesla machine, we will find changes here. Or future approaches like positron emission tomography, which will find biochemical changes which are related to inflammation. But traditional 1.53 Tesla machine are limited to check inflammation here. But your progression 3 points by DSS score is very quick. More than 1 point is considered aggressive variant of MS. So when we make decision about treatment, we should combine two. This is my PhD thesis, actually, and our research and our tradition of our medical school and my chief, to analyze both in cooperation. Traditional medical research like neurological situation, MRI, and lab results, everything, and patient-reported outcomes. This is quality of life, symptoms, and the dynamics. This is what you report me, your symptoms, your disability, and we should analyze both in combination.
So I had a pulse therapy, so 1 gram of methylprednisolone in May, and I was like 80% better. I was like, I couldn't believe it.
So this is confirmation of your acute inflammation. So MS can be active clinically, radiologically, or both. Some people are stable, but they have new and active lesions, but they don't feel worsening. They will start to feel it much later. More common situation are clinical deterioration and new lesions. This is more typical. And what is more typical for primary progressive and for secondary progressive MS, clinical deterioration and stable MRI. Some people have stable MRI, visit doctors, doctor goes, you're okay. I'm not okay, doctor. I'm feeling worse and worse. No, your MRI is okay. You're okay. But you are not okay. Your MRI is okay, but you are not okay. So this is quite complicated situation, because in many cases they don't analyze patient-reported outcomes, your condition, together with, they put all attention on MRI. It's not good. So, but the positive thing for your situation is the quicker progression, the better result of your transplantation. If progression is very slow, less than 0.5, maximum 1 point of EDSS for 1 year, or if MS is stable, for example, more than 1 year, it's not good to provide this treatment. So the treatment approach is based on high-dose immunosuppression. And the more aggressive disease, the better effect of recovery and of this approach. So you are a great candidate for this treatment. Okay. I'm happy to answer our colleagues' questions because this situation is very, very, very important. And many patients have the same problem. So, and of course, I would be happy to have contact with Dr. Milana again on Tuesday.
Yeah, nice. You're right, like always, doctor. So we have another our patient who is coming in next year, I hope so. And Lubomir, I hope you're ready too to ask your questions because we see.
I am ready.
Correct. Can you hear me, guys?
Yes, I hear you. Nice to meet you.
Okay. So nice to meet you, doctor. I hope you're well also.
Okay. So I'm ready to answer your questions.
Okay, so I have two questions. My first question is regarding the do you actually, I don't know, do you make any tests upon arrival of demyelination cause?
You mean the test for multiple sclerosis cause?
Yeah, for the reason for demyelinization.
We provide complete neurological examination, including MRI, general health examination to make decision, is this treatment possible? Do you have any risk factors and like other organ problems? No one center in the world can't provide special test to find the reason of multiple sclerosis, because if you provide a search, if you read scientific research or any other publication, the complete reason of multiple sclerosis is unknown.
Yes.
All factors we can read about in the internet, in the books and research articles are triggers. Infection, stress, low vitamin D, hereditary, these factors are triggers, but not the reason. The reason of MS is masked deeply in our genes. And all we have weak spots in our genes. The name of this condition is genes instability. And let's imagine 10 people. And all these people have affected factors: stress, chronic infection, toxins, they live in bad ecological conditions, low vitamin D. For example, approximately 5 people are okay, but all these 10 people have occult gene problems. But 5 these people are good, they don't have any diseases because they are more resistant. Another 5 people, after triggers during many years, started to have problems. One have MS, one have diabetes, one have stroke, one have cancer. Why they have different conditions? Because they have weak spots in different gene areas. So the reason is deeply in our genes. But and people have this problem many 6 or 8 years before starting MS. It's proved. So all these years people have triggers: vaccination, chronic infection, stresses, ecological toxins. Some people are good because they are more resistant, and some people, after these affected factors, started to have disease because they are less resistant, or sometimes they are less resistant when in the same time they started to be less resistant and they received too much triggers. And they started to have this immunological mistake and started to have MS. So we can know about triggers, but this is not a reason of the disease. So, and unfortunately, on this level of medicine, of science, we don't have any approaches to detect this reason. But we know mechanism of the disease, so this is why we can affect on this disease successfully using transplantation approach. So you asked me about very, very important and very actual problem. So thank you. I hope I answered partly.
Yeah, you did. So my second question is regarding your suggestion, because probably I'm not the only one. You know, I have a kid who is 3.5, a little bit more anyway, but she goes to a kindergarten. She brings to home a lot of you know, a lot of viruses, a lot of diseases. So what is my question is, what is the, you know, what is the, yeah, how can I protect from that?
When patient leaves hospital, his immune system is normal but weaker to compare with other people. But immune system is on the safe level to protect body from these viruses. It's much easier to catch virus infection, but immune system we will find this infection. Also, virus infection can't affect on treatment results. What we recommend during first 3 months: use mask in public places, try to avoid contacts with sick persons, with people who have fever, cough, any signs of flu or infection. And if it's impossible, use mask at home. If a patient has many children who visit kindergarten, it's additional risk, but it's okay. Not necessary to be in isolation. Immune system is strong enough to protect body. So I think only in case of when somebody from patient's family have active infection, you should live in different rooms or wear a mask. But if everything is okay, not necessary. Don't think about it.
Okay. Just a very, very last thing I want to ask. Is it like do people lose a lot of weight from the treatment?
No. Sometimes weight is stable, sometimes 2-4 kilograms in spite of good food and additional protein support in our hospital. So sometimes I joke, this is the weight of your disease, but usually this is 2-4 kilos, not more. And the reason is a chemotherapy, because chemotherapy has catabolic effect, and during chemotherapy, body spends lots of energy to remove chemotherapy agents from the body, to remove products of destroying autoimmune cells, and to build new healthy immune system. In spite of low activity in hospital, patient spends lots of energy for rebuilding immune system. So this is why it's a kind of hard work. Okay? Answer?
Yeah, I understand. Great. Thank you for your answers, doctor. Thank you.
Thank you for your great questions, and you are welcome. We are waiting to meeting you soon.
Thank you, doctor. Good question about weight. To be honest, when I was a patient, I lost about 5 kilograms after treatment. And to be honest, I was so happy, like, you know, all women want to lose weight. And I was so happy to lose some kilograms the same like I did transplant. So, sorry, a little bit another questions. Right now, online, our former patient as well, doctor, he was discharged just a few weeks ago. Marat Mohammed wants to ask you some questions about his condition.
Great. Hello.
Hi, doctor.
Hello,
doctor.
How are you?
How are you, doctor?
I'm okay. Nice to see you. Do you hear me?
Hello. Yes, I hear you, Dr. Rodrigo. You hear me?
Yes, I hear you. So I'm happy to see you again. So how do you feel?
I'm happy to. My body's still weak. Sometimes I feel dizzy, and the migraine returned to me, doctor.
Can you care yourself now?
Yes, I can care myself.
Or
I do exercises. I do natural therapy.
am I right that now you are a little bit better to compare with 2 weeks ago when you leave hospital?
Yes.
Yes. So I understand your situation because chemotherapy is safe, but it's hard work. It's hard job. So, and almost all people after transplantation have temporary deterioration and worsening. So in our research, international experience shows improvement starts after 3 months. Usually 3 is trajectory before transplantation, then transplantation, then stable or down, and then 3 months up to 1 year. And how to make it quicker? First and the most important thing is rehabilitation. Start it as soon as possible if you haven't started yet. And physiotherapists should visit you at home, help you to improve your
Yes, I do it every day, doctor.
Great. This is great.
Every day I do it.
This
Yes,
is why
and I
you are
do some
better.
exercise. I do some exercise, raising
Not
my
alone.
hand.
Not alone, yes?
Huh?
You do it not alone. You do it with physiotherapist.
Yes, with a physiotherapist.
Great. You will be better. It takes time. Be patient. And
Okay,
what
doctor,
about your
I have.
questions? Yes.
Yes, doctor, I have numbness in my feet. Will it disappear or stay?
Did you have it before transplantation?
What do you mean?
Did you have this numbness before transplantation?
Yes.
This is a MS symptom. I hope your symptom will be better. Usually patient improves in symptoms which started in the last year. So,
yes,
of course, but on the other hand, we have lots of examples when all symptoms improved. We can't predict rate of improvement, but I hope you will be better. Sometimes chemotherapy temporarily increase numbness severity. In this time, I recommend you to start vitamin B supplements, which are quite useful for neuropathy and neuropathy symptoms. Vitamin
again,
B
doctor, vitamin B?
Vitamin B group supplements.
Group supplements.
Yes, vitamin B group supplements. Start it in a as soon as you can. And use it at least 3 months.
Can you spell it, doctor, for me, vitamin B?
Vitamin B group, many complexes. You can ask your doctor, your neurologist, your family doctor, and you can find any. In Russia, we have like Milgama, Neuromultivit. I know about Berocca. Berocca, this is tablets you can put in the water and drink like lemonade. Berocca pills. You can find in any pharmacy shop without special prescription.
No, doctor, you didn't understand my question. Can you spell it? Vitamin B group what?
Vitamin B group medications. Vitamin B group vitamin B tablets. Tablets with vitamin B. Not one, B1, B2, B6, many vitamins in one tablet. This is like a complex B group vitamins. Not injections, not... Yes.
All vitamin B group, I take it.
So it's
Right?
enough. If you take it, it's enough for now.
Okay, how many doses I take? How many every day I take? Dose?
I don't know what medications you take. You can send a message to Sclerosis, to Anastasia, and please describe what you take right now and send pictures of medication you use. I will check, okay? It would be better.
Okay, doctor.
Send
Doctor,
message with medications you use. I will help to give you. I will give you my opinion about is it okay and how long you should take it.
okay, doctor. Another question: can I take Neurontin 300 mg?
Yes, you
for
can take, and or actually you should take it. It helps. Yes, take it, please. 300 is good dose for you. Neurontin.
mg. I took one capsule before I sleep.
Yeah, this is good. It will give you good sleep. Also, it's quite helpful for neuropathy symptoms.
Okay, doctor. Another question: when I make a blood test,
please look medical report I gave you. In recommendation part, you can find the schedule of lab results. 1 week, 2 weeks, 1 month, 3 months. If you haven't done this test yet, you should do it in the closest time. And the list of parameters you should check, it's quite simple. And the list in the end of medical report I gave you before leaving hospital. If you can't understand it, please give this report to your family doctor. Your doctor will understand. It's quite simple.
Okay, doctor. Thank you very much.
You're welcome. You're welcome.
Question.
Welcome. I wish you to recover as soon as possible. And any questions behind our meeting, you can send to our email.
Okay, doctor. Thank you very much. I appreciate.
You're
thank
welcome.
you. Thank you.
Bye-bye.
Thank you, doctor, again for your all replies. Look, and another lady, I think Inger can't join us, but text her question. If you don't mind, I ask you.
Yes.
What if I have EDSS and about 1.5, but have many symptoms that destroy life? Should I do already HSCT or, no, as I understand, or wait higher EDSS? What's your recommendation?
Our results and national experience shows the same recommendation. Do it as soon as possible. Because quality of life, symptoms is the same important. EDSS is very simple scale, very, very simple. Patient may have low EDSS, but awful quality of life, huge amount of severe symptoms, and very aggressive MS. And let's imagine fire in our house. We need to stop fire as soon as possible. The sooner we do it, the less we need to repair. The quicker we provide transplantation, the better improvement. And because in a MS situation, every day immune system destroy nerve cells. All our nerve cells are very important. We shouldn't wait for complete disability, because in this situation we can't help. The sooner the better, in spite of low EDSS level.
Totally agree. And like with any disease, right? If you have symptoms of flu infection, something else, you start treatment straight away. Super. Thank you so much, doctor.
Thank you for your help.
Yeah, and a short question from our first friend, brother of our patient, Ronak. She is right now in hospital, discharged on Monday, tomorrow. So just one more additional question. Sorry. What the level of lymphocytes should be on discharge? How much is it important or not?
It's not important, but usually lymphocytes level is 4-5 times less than normal. And this is lymphopenia, is a treatment result of transplantation. And usually it takes from 1-2 months to 12 months for improvement. It's not important how quick immunological recovery takes place. It's important if patient has low lymphocytes level to be protected from viruses. And but low lymphocytes level have almost all patients leaving hospital, and it's normal situation.
Thank you again.
Thank you.
So maybe the next person who will ask you, finally, Andrei, he is waiting with his questions, and we are ready to put him online.
Yes, let's. Hello, nice to meet you.
Hello, nice to meet you, Dr. Fedorenko. Can you hear me?
Yes, I hear you perfectly.
Nice to see you.
Okay, me too.
I was discharged in March, in 8 March.
How do you feel now?
I feel good. But I have days and days. In some days I feel better, in some days I feel bad, but not so bad. I don't know.
Do you use rehabilitation or like physical activity?
Yes, I had tried to make some physiotherapy, but the results was also with ups and downs.
You should have specialist who helps you, and you should have special program. And
but I feel good. I don't feel bad. I have days when I feel good, and
good condition. In spite of good condition, you should be physically active.
Yes.
Physical activity important for all of us. But for MS patients, especially after transplantation, the more active patients are, the better long-term results.
I try to go out each day, every day.
Okay, good. Maybe you should combine not only walking around, but some exercising, fitness, yoga, or physiotherapy. Try to find something like a program approach.
Okay, thank you very much.
Try to do it.
Okay.
And your question?
After the transplant, for how much time you can feel better and better and better?
Usually, improvement takes 1 year, sometimes longer. I met 1 hour from a patient in Scotland last year when we had meeting, and he told me, "Doctor, I have improvement 2.5 years after transplantation." So it's not usual, but possible. But the common rule is around 1 year, maybe a little bit longer.
Okay.
But it
maybe
depends
for me,
on you.
because I get in the secondary progressive MS.
Yes, but the more active you are, physically active, the more exercise you practice, the better result. Only walk, you can feel that I am active, I walk around, but all we have some muscles which are weaker, and rehabilitation science is quite wise. They have lots of exercising to improve balance, to improve separate groups of muscles, to improve mental activity, to improve concentration, to decrease brain fog, lots of approaches. The more complex rehabilitation you have, the better longer results.
I will wait and let the time give my life back.
Okay, please be in contact with me and Anastasia about your results. We will help you.
Okay.
Anastasia, do we have our friends with questions?
Yes, doctor. I hope you are still strong enough.
Yes.
We have Mustafa. He is ready to ask you questions.
Okay, Mustafa, welcome. Hello, Mustafa. Nice to see you.
Hello. Okay. Nice to see you, doctor. Do you hear me?
Yes, I hear you.
Because currently I have issue with audio. Okay. I was on summer 2022 in your excellent clinic, and I had treatment, and now it's I'm fighting with new AI disease called IgG4 related disease.
Oh, could you
So, and I
repeat
want to
again?
ask you.
Could
I
you
was
repeat,
on summer.
could you repeat the name of the
The name
disease
of the
again?
disease, IgG4 related disease.
IgG related disease. So immunoglobulin G related disease.
Yeah,
Yes.
with inflammation and mass or community of on too much organs like kidney, pancreas, thyroid, and two lymph nodes.
And I understand. I know this condition. This is not related to MS. And do you have medical report in English about this disease and treatment you have? It would be nice to analyze your situation because your condition is quite rare, and we haven't have patients after our treatment who started to have this problem. We have more than 2,000 people. Yeah.
It's since two months on October. I started treatment, and I don't know if it's a doctor, and we don't know if it's IgG4 related disease or something else. That's why I just want. Currently, I don't know. Is it or not?
Some secondary autoimmune disease. Yes, some secondary autoimmune disease described in literature and after transplantation for multiple sclerosis, and we discussed the situation with Professor Bird from the US, and the statistic European and American is around 3 to 5% of after autologous transplantation. Because we use protocol without ATG, the risk of secondary autoimmune diseases is the same like in general population in our hospital. So, and if patient starts to have secondary disease after transplantation, usually this disease starts in 12 to 24 months, in 1 to 2 years after transplantation. So I think your disease is separate condition. But we would be happy to analyze your clinical situation if you send me your medical results. And
I can
your
do it.
question.
And, okay. Any recommendation or?
Only one recommendation. If doctor give you prescription for this disease, you should use it. No restrictions from our side. No restrictions from our side.
Currently, the treatment is steroids.
Yes, because you have inflammation, so you can use it safely.
And maybe next step, 3 to weeks.
Discuss with your doctor a medication named rituximab. Discuss rituximab. Yes. Discuss it. Maybe it will help more than steroids. Okay.
Okay, thank you. That's what.
Yes, thank you for questions. And do you have any other questions?
No, thank you.
Okay, thank you. Okay, thank you, Anastasia.
Thank you, Dr. Tu. So anyway, we continue. Please, we have another lady, Nada, who also asks you some questions, please.
Okay, I am ready. Welcome.
Isolating Kuwait. How long isolating Russia?
Okay.
Hi, doctor. How are you?
Hello, I'm okay. Nice to see you. How are you?
I'm doing well. Thank you so much for this.
Okay, ready for your questions?
Yes, I had 3 questions. The first
Okay.
question is, does the transplantation help with the symptoms that happened only last year or throughout my MS life? Because I was diagnosed almost 15 years now.
Okay. Yes, usually transplantation helps with quite new symptoms, 6, 12 months, sometimes longer. Also, we have examples with very significant improvement, with very good improvement in symptoms patients started to have many years ago. Of course, it's impossible to predict improvement in separate symptoms. The main idea of transplantation to save patient from future problems, from complete disability, because MS, in spite of maybe quite favorable cause in the beginning, will lead to disability early or later. So it's quite unpredictable disease, and the earlier we remove aggressive autoimmune cells, the more successful we are in treatment. So, of course, quality of life and symptom severity and variety improves after transplantation. So we proved it, we confirmed it. You can find in our publication, in our website, because we provide we analyze quality of life before and after treatment, quality of life and symptoms. All patients have special questionnaires before starting treatment, and also we send these questionnaires once a year to have information about improvement or stabilization or worsening. So usually quality of life improves significantly after 3 months after treatment. But we can't predict separate questions. Separate symptoms, sorry.
But symptoms like fatigue and depression, these are very common. Would the transplantation help with symptoms like this?
Fatigue usually improves. Fatigue usually improves because patient with MS suffers from fatigue. Almost all patients with MS, 90% patients of MS suffer from fatigue. And fatigue, this is not fatigue like after difficult day. After rest, we are better. You wake up with this fatigue. And this fatigue can be improved by your rest or something like this. This is MS-related fatigue. So if we remove autoimmune cells from your body, the chance to have less fatigue to improve this symptom is very troubling. It's quite high. So
and depression also?
Depression also can be better, but sometimes chemotherapy can make it temporary worse. So how to cope with depression? You shouldn't wait after transplantation. You shouldn't wait for improvement. You should work with psychologists, with psychotherapists. In the severe situation, you should take medications in the beginning. This is meditation, yoga, activity, music, everything, your hobby. Complex approach should be done to treat these symptoms after transplantation.
Then I'm currently taking a MS medicine. It's every 6 months infusion.
Acrelizumab or analogies.
Yes. Do I need to stop it before coming to see you?
Yes. 3 months, it's better to stop it at least 3 months before treatment.
And then after the transplantation, do most of the patients stop taking MS medication?
No MS medications, only symptomatic treatment like vitamins, antidepressants or depression treatment if it's necessary, but no medications treatment. Also, Ocrevus you use every 6 months can cause depression.
And then if I'm interested in doing the transplantation and when I provide my information, is there a waiting list? When would I expect to have to come to Russia? And then how long am I there, and
I
how
think
long?
Anastasia will help more because being in contact with Anastasia, she's an administrator of our clinic, and she's responsible for waiting list, for admission. So I think we have free spots for maybe April, May 2026. Sometimes we have cancellation, and sometimes we provide additional spots if patient situation is very urgent. So be in contact with Anastasia, and we can admit you, I think, spring closer to summer. No problem.
I see. Last question. When the patient arrives to Russia, how long is the patient in Russia? And then once we come back home, how long are we, do we have to stay isolated?
Okay, important question. In Russia, we provide treatment without any rests. We provide very quick examination, 1-2 days, and after 2 days we have meeting and make decision about treatment and go ahead. So usually patient should be in hospital from 25 to 30 days. So after transplantation, you shouldn't be isolated at home. You should follow your normal life. Only avoid close contacts with sick persons and wear a mask in public places for 3 months. Of course, we will provide
thank you so much.
all instruction. You are welcome.
Okay. Thank you, doctor.
You are welcome. Have a nice evening.
You too.
So thank you for question. And about schedule, yes, I just wanted to confirm that we have places since April next year. Also, just additional, we help with visa invitation and give all instructions how to get the visa, about meeting. So communicate with me.
Thank you, Anastasia.
You're welcome, doctor. So we have another person who also asked you some questions. Please continue.
Great. Hello, nice to meet you.
Nice to meet you. Hello. My name is Gamze. Türkiye'yi nasıl tanıyordum? I'm from Turkey.
Okay, great.
I am 36 nasıl tanıyordum? 36 years old. I don't speak English, so I will read my questions. I'm pregnant 4 months. I have PPMS. My MRI has been stable for
PPMS is progressive MS, and usually PPMS or primary progressive is clinically active. More than 60% of PPMS patients have clinical progression without MRI new lesions or activity. So this is specific situation for this variant of MS. So we recommend transplantation because only transplantation can stop PPMS. PPMS is quite difficult variant of MS, and usually PPMS resistant to all disease-modified drugs. So we recommend transplantation in spite of stable MRI.
I am.
You understand me?
Yes. But I am OKB negative, EDSS slowly progressive. Based on this, am I not a suitable candidate for HSCT?
If you have slow progression, low disability, you are in the beginning of PPMS. The final stage of PPMS is complete disability. And in situation like yours, transplantation is aimed to save you from future huge problems. So you are in good condition for transplantation, because usually we have PPMS patients with very high DSS. And in this situation, effectiveness of treatment is much less.
Okay. Soracak mıyız başka? Thank you so much.
You're welcome.
Ben size gelmek istiyorum ama uygun aday mıyım onu öğrenmek istiyorum. Bunu İngilizceye çevir.
Okay.
Okay.
All questions?
I would like to come to your center, but first I would like to know whether I am a suitable candidate.
Okay, please, we are looking forward to meet you in our hospital, be in contact with Anastasia about all organizations. Okay. And we will be happy to help you. Welcome.
Okay, thank you so much.
Thank you, bye.
So nice to get questions from all different countries, different people. Thank you again, guys, to join us tonight.
Thank you. We need to analyze which countries joined to this evening.
You're right, doctor. And another question, doctor, for you from Asama. Please to be ready for more questions.
I'm ready.
Hello, doctor.
Hello, nice to meet you.
Nice to meet you, doctor. Thank you so much for your time. I appreciate that.
We'll do it.
Thank you. I will make it so short. Yes, I get like a numbness in my feet, the right one. I take cortisone. It was perfect for me. It's all numbness disappeared like after 1 week. Now I don't have any disability. I can walk. I can do everything. But I have a lot of lesions in my brain, and also there is 2 or 3 lesions in my spine. And my question is about HSCT. Still now, I didn't take any medication. What do you think? It's better now to do it, or it's not get any benefits?
Okay, this is good question, and this is very important question. About treatment-naive situation when patient haven't had specific medication before. Why you are better? Because steroids, they don't treat MS. They only decrease inflammation and remove inflammation from patient's body. MS treatment, traditional treatment of MS is disease-modified drugs. MS in early stage can be very aggressive, slow, or have normal cause of MS. We can't predict future problems, but you told me about important situation, spinal lesions. And also symptoms you describe like numbness, weakness in your feet are related to spinal damage. So our experience shows that if patient has spinal lesions in the beginning of MS, MS will be much more aggressive and will cause disability quicker than in patients who have lesions only in brain. And your situation is the most favorable for transplantation. Because if you find our article, you can find this article we published this year. We analyzed treatment-naive group. And absence of specific treatment before transplantation is one of the most favorable factors of positive result.
Okay. Doctor.
Okay.
Thank you. And the next question, I have problems with the, it was like with the prostate. In this case, I treated before, but I don't know still now there is a bacteria or non-bacteria. In this situation, what I should do before the treatment? Or
Nothing. We have our hospital is big governmental university hospital. If patient has additional problems like urological, cardiological, everything, we asked our specialists to check additionally. So we can provide prostate MRI, provide additional cultural test, everything. And you can have consultation of our urologist. But usually, transplantation is safe in condition you described, because during transplantation we provide protection. This is antiviruses, antibacterial, antifungal medication, which protects body during decreasing of immune system. So you will be protected against infection, which can come from your bowel, skin, oral cavity, prostate gland. So, but also you can have additional examination for this situation. Also, we can do it. But it can't be a reason which it can't be a problem not to do this treatment.
Okay, and also like now, do you before I came to you, I should take a medication to be in like bridge, like to save my progression, or no?
No.
Okay.
You can waste time. Better not to have medication, because our group of patients who didn't have specific treatment before have the best results. And of course, you won't need to take these medications after transplantation. But another choice, you have spinal lesions. If you have some doubts, or if you want to have medications, traditional medication, you can start it. And in case of traditional treatment failure, you can have transplantation as a second-line variant, not to try to change one medication to another, like first line, second line, third line. You can start with transplantation, which is most recommended from our side. On the other hand, you can try first-line pre-treatment, but we recommend to have effective first-line treatment, not interferons or Copaxone, but start with anti-B cell therapy like acrelizumab.
Okay. But doctor, I would like to start with directly with the HSCT, but like to wait the appointment in your hospital, I think in March or April. Yes,
it's possible. Yes, Anastasia told it's possible.
It's possible. Okay, in this case, during this time, I have just last question about: do you use ATG in the therapy, chemotherapy?
No, because we proved that this treatment ATG use is harmful for results because of high risk of Epstein-Barr virus reactivation, high risk of secondary autoimmune diseases in first 1, 2, 3 years after this treatment. So we combine chemotherapy with rituximab, because Epstein-Barr virus reactivation is the most important problem which can cause relapse after transplantation. This is why many patients who had ATG relapsed during first 2, 3 years because of Epstein-Barr virus reactivation.
Okay.
Also, for MS, ATG isn't useful at all.
Okay.
Some neurologists tested ATG in 80 years as a single, as only treatment like disease-modified drug, and they failed to stop or to improve MS course.
This is that's why I have I was in shock, because I have a lot of lesions in my brain, but without symptoms in my hand, just in my feet was, and I found it suddenly. But in this case, doctor, if it's possible to make also a private consultation with you, if it's possible or not.
No problems. You can have private consultation with Anastasia. We can discuss after New Year in January. Let's do it in January or February when you are ready. We can have private video call. No problems. Okay.
By the way, I am a doctor also.
Oh, great! Great to know.
Yeah, thank you so much. That's why I would like to speak with Anastasia about appointment to take it with you. If it's possible.
It's possible. We will do it.
Okay. I appreciate that. I appreciate your time. Thank you so much for your important information.
You are welcome, and thank you for questions. Let's have private consultation after holidays.
Okay. Thank you so much. Thank you.
Welcome. Bye.
Thank you, doctor. So we are finally a little bit closer to finish. I know you're tired a little bit.
It's okay.
Yeah, you like to talk, right? So just wanted to ask you some question, my friend. Unfortunately, our guys can't join online, and another important question, we still talk about only MS. So look, can we treat scleroderma, lupus with transplantation? Can you give some details about that?
Yes, of course. The mechanism of all autoimmune disease is quite similar. So this is why transplantation is effective in many cases of autoimmune diseases like rheumatic condition, lupus, active and early rheumatoid arthritis, vasculitis like Behçet and other vasculitis, and of course systemic sclerosis, because systemic sclerosis is fatal disease and mortality rate is very high in the first 5-10 years. So transplantation, it's proved by FDA in the US and European Medical Agency and Russian experience. They show that only transplantation can save life in case of systemic sclerosis. But of course, the earlier we do it, the better. Also, we can treat other autoimmune neurological conditions like CIDP, chronic inflammatory autoimmune neuropathy, and rare autoimmune condition like stiff person syndrome and other rare autoimmune condition like rare variants of neuropathy. So Neuromyelitis, Optica spectrum disorders can be treated by transplantation. So actually, I think everybody can find list of the diseases we can treat in our website, HSCT Russia, but we analyze any different cases separately, and we have special application forms, admission forms for multiple sclerosis and for disease not related other autoimmune diseases. So we can analyze all autoimmune disease cases.
Thank you, doctor, for all details. And I think last question for now. Lady is 62 years old, have MS for 5 years old. Is age restriction for transplantation or any other restrictions for that case?
No, this is old MS, which can be quite favorable in this situation, but we need to analyze medical situation carefully. Age isn't a restriction here. The oldest patient we provided transplantation was a lady from the United Kingdom, and she celebrated 70-year-old birthday right before admission to hospital. Also, we had patients 65, 67 years with great success rate. But of course, we provide careful organ examination, heart, lung, kidneys, organ functions examination. So we analyze it separately and make decision together with patient. But actually, age isn't a problem. 62 years old, it's not big age.
Right, doctor. Thank you a lot. So just wanted to wish everyone really Happy New Year, Merry Christmas, wish all the best, much health and happiness, right?
Great. Thank you, Anastasia. Thank you for your assistance, and thank you all our team, our computer specialists and organizers. So, and our friends who join our webinar with very wise and important questions. And I wish all of you to have Merry Christmas and Happy New Year, to have good luck, success, to fight all difficulties in the new year. And our friends who are going to visit our hospital, welcome.
Yeah.
And great. Bye-bye. Bye-bye.
Bye-bye.